begin.
Hello everyone, and welcome back to my show. I'm Dr. Lot from Acupuncture's My Life. Now this episode should be quite interesting to many because I've gotten like a gazillion private chat session requests on the Acupuncture's My Life app about the possibilities of chest pain as a symptom of the flu virus and it possibly being fatal. Now, this is one of maybe 4 times I've experienced so many individuals feeling so worked up about a flu symptom, especially with cold and flu season right around the corner. Now you see, anyone can develop serious complications from the flu, but there are certain groups of individuals who may be at a higher risk of developing complications, such as individuals that are like over 65, individuals with certain chronic health conditions, such as, let's say, diabetes, heart disease, hypertension, COPD, asthma, and even pregnant women can also be included in this group as well as children under 5 years of age, especially children under the age of 2. Now, chest pain is seen as one of the top 6 complications of the flu, and many are extremely concerned, especially being in the midst of a COVID-19 pandemic, of course. Now, to experience chest pain, especially if you're in the high-risk group, going without some type of medical care can have serious and even potential life-threatening consequences. Now, more than 650,000 people globally die from complications of the flu every year. So yes, chest pain as a symptom of the flu should be taken seriously. Now, there are at least 10 causes of chest pain, where some can be as a result of having been infected with the flu virus. And one, let's take for instance, let's say angina, which presents with a squeezing sensation or tightness in the chest. Now, angina is basically a condition that most commonly occurs in people with heart disease and serves as a future warning sign for future cardiovascular events. Now, 2 can be heart attack, which is usually as a result of some type of obstruction that prevents the heart muscle from getting enough blood. 3 can be, let's say, myocarditis, which is inflammation of the heart muscle, which can be as a result of a viral infection. Now, 4 is pulmonary embolism, which is usually caused by a blood clot blocking the flow of blood to the heart and lungs, such as in COVID-19. And 5 can be as a result of musculoskeletal injury. Now, lots of people tend to mistake heart problems with this because the ribs that surrounds the heart and the lungs can become inflamed and cause chest discomfort. Now, 6, which is pneumonia, can be a complication of the flu virus, where there have been cases of the flu that have metastasized into pneumonia. So be careful with caring for yourself should you ever become infected with the flu virus. Now, 7 can be like pleurisy, whereby the thin layer of connective tissue that basically wraps around your lungs to keep your lungs from rubbing against your chest cavity becomes inflamed as a result of, again, a viral infection. Let's say number 8 could be acid reflux, which is as a result of stomach acid moving up into the esophagus, causing what most people refer to today as heartburn. And 9 can be, let's say, panic attack, which is usually as a result of a psychological reaction to panic or fear. And 10 could be as a result of, let's say, sore muscles due to an excessive dry cough. Now, a constant dry cough can aggravate chest muscles. Now, there are plenty of reasons as to why an individual can experience chest pain, whereas if some are not addressed in time, can lead to serious complications and in some cases, even fatality. Now, when it comes to traditional Chinese medicine, chest pain as a symptom of the flu virus can be seen as chest painful obstruction syndrome, whereas an external cold can invade the chest and obstruct the circulation of yang qi, which leads to chest painful obstruction, where you'd experience an oppressive sense of pain in your chest. A pre-existing condition, just like in Western medicine, in the case of Chinese medicine, a pre-existing deficiency of yang in the lungs or heart can predispose the body to an invasion of cold in the chest. So along with consulting your primary care physician, you may also want to sit with an acupuncturist or simply contact yours truly himself, Acupuncture is My Life, to discuss how acupuncture may help those experiencing chest pain. Now, don't forget to go to the Google Play Store and download the Acupuncture is My Life app, as well as subscribe to this channel to learn more about acupuncture, Eastern nutrition, Chinese herbs, and plant enzymes. And until next time, acupuncture is my life. What's yours?